thank you very much. I'm very pleased to be here, so thank you so much for inviting me. And it's so nice to see so many of you that have showed up here. Well, I'm the CEO of Sahlgrenska University Hospital, and I'm also a professor. And I think this combination, I really like it, and I think it's quite good because you can make changes in the management of the healthcare when you have both these competencies, so to say. So I will get into this a little bit. But we will also talk about innovations, and I think we talk sometimes, about low tech, high tech, and then we have Y tech. And I think Y tech, maybe this is not what we are asking for. We have to put our patient in focus of the innovations. We have to ask the patients, what are your needs? We have to have patient-driven innovations, also including the different healthcare professionals, but we have to focus on the patients so that we do get good devices that are simple to use and that really make a difference. So I will get into my next here. And I will start just by putting Sahlgrenska University Hospital on the map, world map actually. We are one of the leading university hospitals in Europe, and we're also one of the larger university hospitals in Europe. We have a staff of almost 17,000 members, so that is quite large, and we're situated on different sites all over the city. And we're also really, really proud to have the most national specialized medical care assignments in Sweden. I will get into this in a little while. And we have different tasks, and it's quite important that we combine these tasks. And that is, we are being a specialist hospital for the Western region here on the West Coast. We are also very specialized, national specialized, and then we are a county hospital with a broad variety of patients. And we educate. We have an advanced R&D program. We educate a number of students, and we're also into innovations. And what is unique here on the western part of Sweden, that is the closeness between the university hospital, between our technical university called Chalmers. I sometimes say it's quite easy, you can almost spit from Sahlgrenska to Chalmers. You have to be a good spitter, but it's very close. And then we have our business school, just to mention some. And then, of course, Sahlgrenska Academy and the university. So we have the closeness, we have the really good people in the different sites, and we just have to keep on collaborating. And also, we have the industry. We have the large industry, also quite close, and we also have small industry and mid-large industry. So we just have to put this together and keep up the good work. And one thing, we are very good at talking. We also have to be good at doing. What do they say? Sometimes they say you have to walk the talk. That is the thing, we have to put this so we really do what we are talking about. Here, I have to brag a bit. We have the most national specialized medical care, rikssjukvård in Swedish, and you can see it's pediatric heart surgery and surgery on grown-up congenital heart disease in adults, a number of transplantation performances and craniofacial surgery. We have the professor here, Anna Elander of the plastic surgery department doing this. And then we also have glaucoma in children. And we're very proud, and we're applying for 2 more, and that is regarding gut surgery in children. I usually, when I talk to members of the staff and talk to people like you, and so I always stress our mission. And our mission can be divided into 3 parts. And that is what we all know quite well. It's our clinical activity. And then we have our R&D. And that includes, we have to stress education. That is quite important. And that is why we are very dependent on the large number of patient groups with common diseases, not just very rare or specialized diseases. We have to have the broad picture as well with patients. And then we have the innovation part. And this is something that is really important for us. And then it comes to the 3rd part of our mission, that is collaboration, as I said, with university, with the academy, with our technical university, with business school, and also with the industry. And this is one thing that we now are taking into account, and that is the managers, the leaders of the university hospital. They have to have a knowledge of all these parts. Because in order to coach your staff, you have to have the knowledge of R&D and the collaboration. It is just not sufficient to know about the clinical activity. You have to be able to combine these 3, and you have to be able to coach your staff in all these 3. And I think that is what is the new thing, that our managers on all levels have to have the knowledge in these 3 areas. Otherwise, we cannot take this further. So that is something that I stress quite a bit. And then we are in international world class in many parts of our fields. And that is, just to mention something, that is in dementia, for example, and also different types of transplantation. And as I said, we are cutting the edge together in R&D, together with Sahlgrenska Academy, the industry, and also with international collaboration. We've heard about Arvid Carlsson and the Nobel Prize, and I think Arvid Carlsson is one of the oldest member of the staff, and we are very happy to have him up here and to see him sometimes walking in the corridors. And I would just like to mention also another Nobel Prize winner, that is Thomas Lindahl, who worked here at the Sahlgrenska Academy. He got the prize in chemistry a couple of years ago. And then we have all the big companies. I've just put on some of the names here, but we also have the middle-large companies, and we have the small start-up companies. Everyone are quite welcome, and we have to have different types of collaboration with different types of industry. And then I just want to point out what we are also very proud of, and that is our Image and Intervention Center. That was inaugurated here in September in 2016, where we have the latest in image and in hybrid operation rooms, etc. And we have a very nice collaboration with different parts of the university and the industry. And one thing that I also would like to stress, in order to now really get on with our collaboration, it is quite important to have the transparency. So I think we should provide good platforms where we can all come together, and we should follow rules, have the transparency, then we can have the peace and quiet and work together. So this is something that we have to provide, and I think we're doing this on the innovation platform with Sahlgrenska Science Park and so forth. We also have to provide for academy, university, and for industry different type of test beds, so that you can try and see really quite fast, is this a good thing? Does it work on patients? Can we use this type of device or whatever? So test beds, I think, is something of great importance. And then the innovation partnership. And I get back to that we as leaders, we have to stress that this is something important as well as our clinical activity. We have some examples, but in order not to drag on this, and I will get place for the other speakers. I will just, show you very fast, and you can get my presentation. We have collaboration with a number of companies here, just mentioning some: Mölnlycke, Essity, Johnson & Johnson, Mevia, Urgis, and with RISE, the big innovation platform, and of course with AstraZeneca, etc., etc. I'm going back to that it has a number of perspectives, and I will also once again say that our patients, we have to have them in the center of the innovations. And one thing that we know from patient collaboration is that the patients really do want to take a part of this. And we have to listen, and we have to put into account the patient-driven innovations. And then we also have to sit down and talk with the academy and with the industry. What do you want? What do the healthcare providers, the different professionals, what do they want? Here are some examples of this patient-driven innovation and patient platforms. We have something that you all know about, I think, and that is the patient-centered care. It was started here by Professor Inger Ekman, and she and her co-workers are working here and also at the university. And here we put the patient in center, or the patient is an equal partner to the healthcare professionals. We sit down with the patient and we ask, and the patient tell us what their needs are. And we have done a lot of research in this field. And one thing that one can see is that, for example, hip surgery with replacing hips, you in the oldest part of the patients that are over 80, over 90, we can reduce the time that they are spending at the hospital with half. So if you sit down and collaborate with the patient, a lot is gained and the patient feels much better as well. Then we have the patient innovation, patientinnovationssluss, where the patients can come and meet different companies and meet the healthcare. And we have produced a booklet together with kidney cancer patients, and also I think it was Lotta who spoke about this crowdsourcing and the crowd ideas regarding breast cancer. Well, it's the partnership and it's the collaboration. We have different roles. But one thing that we do is also of importance, and that is to map the different needs. For example, you can map the process for the patient, starting from the beginning and then follow the patient through the whole process before the hospital, in the hospital, and after the hospital. And what can we do in order to make life easier, for example? And we know, looking at compliance, I'm a dermatologist myself, and we sometimes prescribe different ointments. And we've looked into this. Do the patients really use the ointments that we prescribe? Can you imagine to what extent do they do as we tell them to do, using ointments? Think about it yourself, twice daily for 3 to 4 weeks. 20% do as we tell them to do. Yeah, and we've seen regarding pills, it's about 50% compliance. So here we have really something to work with, just as an example. So map the patient's way and looking what can we do for the patient here. And I will finish with this, something very interesting. Also for me as a dermatologist, and I think we have a collaboration here with the plastic surgeons, we can write with a 3D printable device, new skin, using it for wound healing, for example, or making a new ear, a new nose. So we are really cutting edge here together. So with this last picture here, I will close, and I will hope that you will have a very nice and interesting day. You will get to know each other, and I will go back and tell my staff, you have to know all the 3 missions, and you have to coach your co-workers. Thank you so much.